Thank you so much for all of the fascinating talks. What I'd like to start us off with is these EPICS studies. So you've got two different results here for the all-cause mortality. I wonder whether you could explore that a little bit more for us.
Shall I kick off? Yeah, okay. Yeah, that's an important thing to resolve. Why is it different, given that we're both looking at the same dietary exposure, or at least we think we are? So methods make a difference. And in the EPIC Oxford study, I reckon there's greater scope for misclassification because it was a binary choice, a score of 1 or 0. So if you're above it, you get this score. If you're below it, you get 0. Whereas the work we did was a score of 0 to 140, and it was graded and scaled and ordinal. So if somebody had increased higher or lower intake compared to the reference, they would get scored proportionally between 0 to 10. So it's not just yes or no. It could be a score of 1.5 or a score of 8.2. So that gives greater granularity, greater accuracy, if you will, and less misclassification, which of course picks up a stronger relationship. So there's less attenuation of the association. I don't know if you want to add.
Yeah, no, I completely agree. And I think also the number of deaths in the study that Nita presented was the total number in the cohort that we looked at, not the number of deaths, but the total participation. Also, I think you have, Nita really nicely talked about nutrients, food groups, and we might all be eating a fruit, but then the nutrients in that fruit are going to be different. And then we're all going to be eating a food group, but then the fruits in that fruit group are going to be different. So also what you eat within a score and how people eat might be different. And of course, our cohort is quite unique in that we do have a high proportion of vegetarians and vegans that might meet the score in a different way. And like we saw, for instance, with our stroke results, that what you're eating within a score is also potentially going to have an impact, and then your reference group and who you're comparing to. And we don't even have anyone who has a 0 in our cohort because they didn't have a hard time meeting the score as well.
Could I just add something on stroke, although you only asked about mortality? Yeah, okay. So we were really interested in the findings from the EPIC Oxford study on the vegans and vegetarians with higher incidence of stroke. So with the planetary health diet, we examined, we did a systematic review of all the different grading systems for deriving that index or score. We compared 7 different systems. And the binary ones versus an ordinal or the proportional grading, what we found for stroke incidence in this particular systematic review and then meta-analysis and individual studies was with the binary ones, we saw inconsistent results, either increased stroke incidence or null or even reduced, but where it was either ordinal or proportional with granularity of how you score, there was a consistent inverse association. But of course, it was not limited to only vegans and vegetarians. It was in the general populations of these different cohorts. We tested this in 3 different cohorts, 1 from Mexico and 2 from Scandinavia. This was published in the Lancet Planetary Health journal last year, if people are interested.
Thank you so much. I think this highlights an issue, doesn't it, in the sense that how do we communicate this? And there's a question online. The message of some risks associated with plant-based diet can be used as an argument against dietary shifts, despite the evidence that you showed that moving in this direction is hugely beneficial. So how can we, as researchers, target our messaging so that the small risks are not exaggerated by vested interests and used for excuse for inaction?
Sorry, do you want to go ahead? No, go ahead.
With great difficulty.
Go ahead, Nita.
Okay, that's a big question. So my thoughts briefly are that we need to focus on the big killers, the big things that cause disease burden and loss of healthy living. So you live long, perhaps, but you have a poor quality of life. You're disabled by your illnesses. So if focusing on that, then there's a clear win for the plant-based foods. Where the challenge comes in is with both speakers having spoken, showed results on nutrient inadequacies for some things, but nutrient benefits for others. So where the inadequacies are, if we look at those micronutrients, particularly B12 and iron and iodine, the solutions are actually not expensive. Fortification, supplementation, an exchange of foods within. So if so there was some modeling work done with the Eat Lancet modeling, diet modeling, where if instead of all vegetables you were to focus more on green leafy vegetables, then you can improve the status of some of the things and within the other things. So I think there are some solutions, and I would say while the micronutrient inadequacies are absolutely important, and particularly for some population subgroups, as was highlighted, the biggest impact on human health is from getting disease and disability. And there are solutions for the micronutrient inadequacies.
All right, great. Is there any questions in the room at this stage? Does anybody want to ask a question? Oh, there's a lot of questions in the room. Can we again? If you're back there already, yeah, that's fine.
So I'm just going to reiterate a question that I had put and others had posted in the Q&A on the app, which is whether, as part of the analyses that you did, you looked at health inequities or health inequalities, however you want to frame it. And there was another question specifically about how to design policies to address inequalities, I think, from someone else.
Yeah, we'll move on to that, yeah. The inequality, you want to do?
No, I think that's your neck of the woods inequalities.
Okay. Crucially important. And that's what the justice in the system and the transformation is going to be really critical for, in terms of how do we make diets affordable, diets that are healthy, affordable, because I think people in this room know and on Zoom know already that by and large healthier diets do have a greater cost to the individual or to the household. This is not something new in the sense that we've known about this for a very long time. You know, when the 5-a-day message of fruit and vegetables was around for the last 40, 50 years, the WHO message of 5 a day, even that can blow household budgets completely to meet 5 a day, let alone when you're trying to meet the entire healthy diet framework. So in terms of the analysis we did, what we were able to build in was limited to the data that was collected. So we did account for people's education level and their occupational social class. Some of the studies have also accounted for income. But that's the best we've been able to do so far. But going forward, I think these need to be done as stratified analyses to look at what the impacts are, whether there are interactions by socioeconomic factors in terms of the health impact, how that's affected. So more work needs to be done, but by and large, we know that the governments, it won't be up to individuals, it'll be up to policy and action at government level to make, you know, through subsidies and all sorts of action, to make healthier food the easier option or the affordable option. But it's the biggest challenge in the field, I'd say.
And that's a great jumping off point for the highest rated question here on how can policies promoting sustainable diets be designed for all groups. Karen, do you want to go? Quality question. We do actually also have the two questions here at the top here. We've got on policies and how policies can accelerate the transition, and that will be in session 2 as well. So we'll get into a lot of that in session 2. So we can skip that for now. Dodge a bullet. Any other questions in the room? I saw quite a few hands up.
Hi, thank you. I'm also going to reiterate one that I've put on the app, which is about, we sort of artificially separate climate mitigation and adaptation, and you've presented a lot of evidence about lower greenhouse gas emissions and sustainable diets. It feels like these diets would be more climate resilient as well, and I'm wondering how much evidence there actually is to sort of confirm or explore that side of things too.
Does anybody want to? Well, I talked a little bit about this. Early research, on this suggests that these plant-rich diets are more resilient to big supply chain shocks. So we had a study looking into the impacts of the Russia-Ukraine war, for example, and found that these diets could actually account for most of the loss in the Russian and Ukrainian production of food, essentially. And that's because of basically reducing the size of the agricultural system in many ways for the feed, and you could then use that for biodiversity and nature gain and things. And so the resilience is sort of both direct in that way, in the sense that you're changing the flows of food and the food availability, but it's also indirect in the sense that with these landscape changes, you're also getting your climate resilience as well. And so if we're looking at large-scale land use changes, which is likely to be needed for flooding. If you look in the UK, flooding is the biggest single climate hazard that we face. And the climate change risk assessment suggests that this is going to sort of breach £1 billion worth of damage very soon, actually. It's already getting to 800 million each year. And so these flooding impacts, obviously, you can't really do much about that without these sorts of landscape changes. And some of those landscape changes are around how we use the land for agriculture, given that it's about 70% of the UK landmass. So I think it's an area of interesting, recent research. Thanks, Seth. And we've got a question at the front here.
I can probably just speak from here.
We need it for the online audience. Thanks, though. Yeah, no.
I always feel awkward speaking in the microphone, especially from up front. I actually have 3 questions, one for each. So do I need to pick one, or can I ask all 3?
Well, you can ask 3, and then we can decide which ones we
Okay.
answer.
Okay, so first question is on the first presentation that we heard. Very interesting, thanks so much. I wanted to ask how you assessed biodiversity loss. I work a lot on nutritional life cycle assessment, as well as life cycle costing and different types of life cycle assessment. And that is one of the biggest challenges that we have, measuring biodiversity loss. We find that current methods are pretty inadequate and do not really capture the comprehensive picture of what it means to lose species, basically. So that is my first question. Second question is on fortification and biofortification and supplementation that you mentioned, which can definitely fit within the package of solutions in the transition to more sustainable diets. These also have downsides, though. First of all, not everyone needs the same amount of nutrients. How do we ensure that everyone gets exactly what they need and not more than that, which can also lead to toxicity in some cases. Vitamin A and in pregnant women is one very famous example, but there's many others. And also, how do we ensure compliance to fortification standards? I work for a development organization that mostly works in the global south. And what we observe is that compliance to standards and regulations from the government is very low from the industry. And how do we ensure compliance of people as well to sticking to taking those supplements or eating those fortified foods? And then my last question, and then I'll stop, I promise. So my last question is more of a comment than a question. Some of the latest analysis that we conducted at GAIN, I work for the Global Alliance for Improved Nutrition, actually show that I'm taking the UK case study, but there's many other developed country case studies. In the UK, there's about 50% of women of reproductive age that are deficient in at least one micronutrient. So my comment is more, you talked about vulnerable populations in the global south, in LMICs, but in reality, deficiencies are a true problem and a real problem also in the global north. So it's more of a comment, if you could just, let's say, comment on that and clarify your statement that it's only at the global south that we should be looking in terms of deficiencies or inadequacies, but we have them in-house as well.
Okay, thanks. So biodiversity.
I might briefly touch biodiversity and dip a bit into the fortification then where I might be more useful. I'll be honest, it's a collaboration effort. So my colleague Michael Clark is the expert here, and we used a lot of the Hestia database for a lot of our life cycle analyses, which I'm sure you're well familiar with. And in addition to this, did a lot of Monte Carlo analyses, a lot of simulations trying to give some sort of a variance around whether what happens here, what happens here, what happens here, and of course, how long is a piece of string. So he would be the best person to ask about this, but I imagine you've used Hestia before, and this is...
That's why I was wondering.
Yeah, so that's why the simulations is the way we try to at least give some sort of a boundary around it because of that issue. Yeah. I'm going to dip a little bit into the fortification. I think it's a really important point, and if you look in the UK, for the last 20 years, our Nutrition Advisory Board has been recommending that we add folic acid, which has been added in several other countries as a mandatory thing to our flour to prevent neural tube defects, and nothing has been done in terms of policy because of potential risks of types of cancers where the evidence was not as strong as the benefit of the neural tube defect, and it has led to a delay. And that was a cost-benefit analysis, I suppose, of not enough neural tube defected babies coming out, so until we know better, let's not act on it. So it doesn't always, those risks can lead to huge delays until things are fortified. Of course, you do have individuals that can make decisions, and I think a lot is already put on the individuals, which is really difficult. Even like if you take a carton of eggs home that says, you know, put in the fridge at your own risk or whatever, it's on you to keep the egg out of risk. That's asking a lot. There are some things that you can add to foods that the person doesn't even have to think about that are pretty low risk and low cost. So in an analysis, when looking at in doing the feed study, we asked people to tell us what foods are you eating and tell us about the brands, so then we can go and find out what are the nutrients in these brands. And we found overwhelmingly that calcium was added to 60, 70 or more % of the plant-based milks. Vitamin D tended to sort of come along, riboflavin, and iodine, I don't know what we agreed on, but I'm gonna go for iodine, was this often added. So then that's a problem, and people don't even know. And then some folks have organic plant milk, and they have no idea, I don't know if they know, some may not know, that they're not getting any of these added nutrients. And then, do these added nutrients matter? Does calcium added in a soy milk act the same way, potentially, on preventing colorectal cancer as it does when it's added in bread or when you're finding it in dairy foods? There's more questions for research. So in addition to risk, what are even the benefits? But I think some things are easy to do. In Australia, we had vitamin D added to the milk. Here, that's not something that happens. That's a decision. You don't even think about it. In America, you look at the cereals. It's so heavily fortified. And then the whole discussion of ultra-processed food comes into it, and you're thinking, but so much of our nutrients are coming from some of these foods. What would you be causing if you're not? So yeah, you could tell people, okay, well, you're a high-risk group, or okay, you're about to get pregnant, so maybe you need to be putting a bit more folic acid than the average bear. But then for some things, maybe we don't know enough about the risks of maybe increasing your calcium intake to a certain higher level. So are there risks? And if we don't know, is it worth delaying some of the actions that could really be important? But if 2% of the population is vegan, if 6% of the population is vegetarian, so, right? The numbers are small. And of course, this doesn't even talk about vitamin D potentially for some groups of the population that are covered, maybe that are getting so much of the available sun that's here. I don't think this is a straight answer. You are more of an expert here.
That was tremendous. I think you answered like 80% of what I would have said. What I can add to that is it's really important to, again, go back to the methods. So we were talking earlier about even the classification of how you score can make a difference to the misclassification, the attenuation of the effect size, and so on. And the same applies to the nutrient calculations. We somehow assume that these nutrient calculations are all exact and accurate, and they're not. So what you're doing is you're asking people what they're eating. From that, you're attaching it to food composition databases. We've got a food composition database expert sitting here with us. And from that, and these are incomplete, and in many countries, they don't even have these. So you're applying it from USDA to parts of Africa, right, etc. And then you're saying, oh, B12 is low, or iron is high, or iron is low, or folate is this, etc. So I think we just need to call on our physiology physiologist friends and say, all these biomarkers you're talking about, can we actually measure it more accurately? So I think that's important. Methods are important. The second one is that, what was I going to say? It was right there, but it's gone. Maybe if you speak and I'll come back to it. There was a second point I wanted to make. Yeah. Oh, sorry, it's come back. Right. It's come back. So you've always got to think about what you're comparing it against. So what are people currently eating? What are the current diets? And if in many countries, we know that ultra-processed foods are what people are largely eating in their food basket, getting in their food basket and so on. There are already nutritional inadequacies. So I think we've got to say compared to what? So we also need to look at if people go for more plant-based and where feasible, still have the animal source proteins for digestibility and completeness of the essential amino acids and all of that. Then what's the benefits and harms? And actually there's a third point to be made, which is somebody needs to do the work, researchers need to do the work on, there's some critical micronutrient potential deficiencies, particularly in low-income countries, but what are the, how does that weigh up against the benefits from the current almost universal lack of adequacy for fiber intake, for instance, right? We need to do that.
Answering your first point about these deficiencies not just being in lower income countries, completely agree with you. There are going to be, say, vulnerable populations in all groups where it's going to be the risks of nutritional inadequacy is going to need to be studied. So I completely agree with that point. In terms of your point about adoption and how do we monitor compliance, I think that as alongside physiological scientists, the other group or academic discipline that is key to this is behavioural scientists. And I think that it would have been very nice if we've had an extra 15 minutes to have had a how can behavioural scientists support the adoption of these diets? Because we can come up with healthy diets. People have known this for years. We need to know what is their drivers for adopting them and actually complying them. So just to as a sort of an example, again, the work we've done at the Bezos Centre when we started this project, we did some like PPI, some work with the public in terms of, well, particularly with meat eaters, and what we discovered was you were never going to get people to change their intake of, or not never, but it was being highly likely to get them to change, I can't think of the correct term, but unprocessed meat. So things like steaks, whole chicken breast, things like that. You're never going to be able to create an alternative for those. People are still going to want to eat those. But within the UK, and I think it'd be the same internationally, that the vast majority of red meat is eaten in mince format, so in a highly processed form, and that's where the win is. People won't mind as much if you can come up with tasty alternatives which are appropriately nutritionally fortified to replace that large amount of red meat in particular, which is in mince form. So again, just by actually talking to people, the actual people who are going to buy this, I think we can actually understand what are their drivers to best get them to actually adopt and to comply.
Great, thanks. Josh, we've got some questions over here.
Thank you very much indeed for all the discussions. It's really just a comment, just to say that today, actually about 52 minutes ago, the Committee on Toxicity and the Scientific Advisory Committee on Nutrition have just published their risk assessment of plant-based drinks. And so actually, I mean, the timing of that couldn't be better. It was, it wasn't supposed to, we didn't time it like that. We've been working on it for about 3 years, but it just happens to have just been published. And that will be, I think, so helpful. I hope you will think that both those committees have done a very rigorous assessment, and it addresses quite a few of the nutritional inadequacies that you said about. So hopefully that will be very helpful.
Thanks for bringing that to the attention. Yeah.
And just to add to that, folic acid as the issue, finally, SACN did pronounce on it, and now it is going to be implemented, right?
If I could
Fortification.
Yes. If I could just say, SACN have been and before that coma, have been clipping at the heels of the government for 3 decades. So actually it wasn't, the hold-up wasn't Sakan. Actually, it was the governments. We have written to ministers. We have done so much to try and get that on the agenda.
And it's happening now, which is a good thing.
Finally.
And just one or a few points. One is that maybe currently we don't have the evidence we need to assess the impact of vegetarian, vegan diets because of the inequalities. We know that it tends to be a diet adopted by high-income people or middle class, and so with some degree of knowledge about nutrition and supplementation. I wonder if it would be the same if we were going to get people from the lowest deciles of deprivation. They don't have the same awareness, and when they switch diets, they may incur a greater risk of nutritional deficiencies. And when it comes to nutrition deficiencies and supplementation, I'm not really worried about B12 and folate because the alternatives, the supplements are very good. The problem is with iron because metallic iron is not properly absorbed, and that's where the challenge is. Iron is not equivalent to elemental iron, and that's where the problem is. And I know, for instance, the problem in India where most people are vegetarian or vegan, and pregnant women end up in pregnancy with hemoglobin levels of 5, 4, and that's the main cause of maternal mortality is bleeding and iron deficiency.
Thank you. Thanks. Yeah. So maybe a comment maybe on the number in the samples from different income groups would be really interesting if you.
So we're kind of dependent on the data that is collected, but when setting up new studies, I think we can insist on collecting more granular data. But in the historical cohorts, it's been limited to things like education level, which is a good marker or a proxy for both income and kind of knowledge about healthy and unhealthy foods and so on. So typically, the cohort studies have collected socioeconomic status in that way, but we need to do better. But just one comment I wanted to make. Of course, it depends on which country or area one is talking about. So when you say that most people who switch to or choose to be vegetarian or vegan, they're more affluent, more educated, that's true for places like the UK, perhaps, but by contrast, in India, which you also drew out, it's exactly the opposite. So it's a misconception that most people in India are vegetarian or vegan. Actually, a great proportion of people want to eat meat and do eat meat if they can afford it. But it's the poverty, which is why they can't consume it. So the pattern is exactly the opposite. And that's why the solutions are going to be completely different in different places.
Yeah, you made an excellent point about the iron fortification. And again, it just gets to that point that you can add something to a food. It doesn't necessarily mean it's actually going to get into you. And I say this is one of the main research focuses of the Bezos sustainable proteins. It's actually how can you actually improve the bioavailability of supplemented iron.
Thank you very much. Could we thank? Oh, sorry.
Oh no, just to answer to your question about where are the data, and interestingly, I completely agree. Depending on where the data were collected and the motivations for becoming vegetarian or vegan will also affect what we call confounding structures. So what else is going to come with this person's lifestyle? And most of the data that we have are actually from Adventists in California and Epic Oxford. And these Adventists are not having tea, coffee, alcohol, smoking. So you could say, oh, that's a really unique group. So then is that an ideal group to look at because you don't have to worry about smoking and alcohol? Or is it an opposite of ideal because most people are not going to be that way inclined? And a lot of the health results we've seen is because we've had sort of smaller, generally, less adiposity, and we know adiposity affects so many health risks. And even in the small feed study, we're seeing that's not happening. People are gaining weight. So are some of these health risks going to change in time alongside what they're eating and how we're measuring it? And then, of course, why they're following these diets and can they afford it? And we tried to pull together all of the available data, and we said, let's take every big study that's out there, and they're bound to have enough people. And we had the China Kadoorie Biobank, which is 500,000 people from across China, and they had loads of people who were vegetarian. But in a resurvey, when they were measured their diet again, suddenly they were eating meat. They had more money. So they weren't eating meat before or dairy just because they couldn't afford it, which was not at all motivated by whether it was religion or whether it was animal welfare ethics. And those motivations might tie into different things than what we see for body size and other things that affect health, which we might see when we measure physiology. And there's a dearth of data. We're working on it. And I'm excited for what the research is bound to bring. So watch this space because we need to answer what you're asking.
Thank you so much. Thank you so much for some really fascinating presentations. Thank you so much for your great questions. The next session, we're going to be moving into the policy domain. What can we do to really support the shift to healthier diets? But for now, can we all thank the speakers once again, and we'll see you next time.